Time now for our mental health moment of the week. ADHD isn't just a childhood condition. Recent data shows that more than 15 million American adults are currently living with ADHD, and adult diagnosis rates doubled between 2020 and 2022, especially among women. And here with us to discuss is Sweetser's medical director, Dr. Marc Kaplan. Welcome, Dr. Kaplan.
Thank you again for having me.
Oh, always. So what exactly is ADHD, and why are we seeing more adult diagnoses?
So ADHD is a biological neuropsychiatric disorder, and there are some symptoms that are very common. You have inattentiveness to work-related tasks. If you're doing something fun, no problem. But when you have to hunker down and do some work, big problem. Secondly, you have hyperactivity if you're a younger person, especially boys. And I mean hyperactivity, like the Tasmanian devil. Third, you make really poor decisions because you don't think before you act. They call that negative behavioral impulsivity. So we have that too. The diagnosis has been around for many, many years, but it's only within the last 30 years that people got aware it can carry on into adulthood.
Yeah. So tell us a little bit more about that, because you're talking about women being diagnosed more. Why is that? So
when the diagnosis was first understood back in the 60s, it was focused on little hyperactive school-age boys. The girls were biased. There was bias. They overlooked them. Oh, they're daydreamy. They don't really care about school. We've come to understand they present differently with their ADHD. They're not hyperactive. They're not behaviorally disruptive. But they do things without thinking, and they're really inattentive. And now that we understand that, and we understand the disorder goes beyond puberty into adulthood, we're helping many adult women now that have always thought they're lazy, crazy, or stupid, and they struggle with adulting. And then we treat them, and it's like getting a new brain.
Yeah, new lease on life, I would imagine.
Absolutely.
So how do you distinguish between ADHD and a condition that might look similar to it?
Sure. Many conditions in children will present with them still being like wiggly and squiggly and hyperactive. Depression, trauma, all those things. So you look for a diagnosis that's been fairly solid since the age of 12 or under, and is 24/7, all the time. That's really key, where mood disorders have episodes. They come and they go.
Understandable.
Learning disabilities are very focused on a specific learning disability, not everything.
Okay.
Yeah.
Very interesting. Thank you so much. Especially the part about women being diagnosed more between, the last couple of years or so. We appreciate you coming on the show, Dr. Kaplan.
I'm really glad to be here, and I just want to mention Sweetser has the Hope and Healing Centers in Sanford, Lewiston, and Brunswick. We can have somebody walk in and they could get identified as having ADHD, if they do, and begin treatment.
Okay. Resources are available.
They are available.
All right. Dr. Kaplan, thank you so much.
Thank you so much.
And we'll be right back.